Alright, so first you start by observing the thorax. Observe the spine for any abnormal curvature. Some abnormalities may be kyphosis, lordosis, or scoliosis. The ratio of the anterior to transverse diameter should be 2 to 1, and notice the height in the shoulders should be equal bilaterally. Observe for symmetric chest expansion with each breath. To assess respirations, watch the patient respiration pattern with one respiration being one inhalation and one expiration. Observe the patient's respirations when they are unaware, because this may skew the results. Adult passive breathing should be about 12 to 20 breaths per minute. It should be easy, normal in depth, not shallow or deep, and the diaphragm and intercostal muscles are involved in breathing, as well as select muscles of the neck, chest, and abdomen. Breathing should be silent with an occasional sigh present. Next, you can assess the trachea. Stand in front of the patient using both thumbs to palpate the trachea. Trachea should be palpable, slightly movable, and midline. Next, you can palpate the thorax. Use the palmar surfaces of your fingers to feel the texture and consistency of the skin and chest and alignment of the vertebrae. On the anterior side, the thorax should be symmetrical, as well as the clavicles and the rib cage. Notice any tenderness or masses, and the skin should be dry and without lesions. On the posterior side, palpate the spine, making sure it's straight and it should not be painful. Alright, next you can auscultate the lungs. The diaphragm of the stethoscope is used for this because breath sounds are high-pitched. To best auscultate the lungs, have your patient sit up straight and breathe in and out through their mouth. You start at the apex of the lungs and move to the base of the lungs, which are at about the 12th rib. Hold the diaphragm over the spot for a full respiration before moving on. So make sure when you auscultate the lateral sides of the lungs, you do it symmetrically, because otherwise your results could be skewed. Breaths should be audible and clear without any crackles, wheezes, or rhonchi in all lung fields. So some characteristics of breath sounds are bronchial, which are heard anteriorly over the trachea, bronchiovesicular, which are heard anteriorly in the first and second intercostal space and lateral to the sternum, and they're heard posteriorly and posteriorly between the scapula and the spine, and then versicular are found in all peripheral lung fields.